Arthritis is a term used to describe joint pain or disease. In dogs and cats, the most common type of arthritis is called osteoarthritis. This condition is often referred to as degenerative joint disease because it is indicated by degeneration of joint cartilage and damage to underlying bone. For dogs, the most commonly affected joints are the hips, elbows, lower back, knees, and wrists. And the most commonly affected joints in cats are the shoulders, hips, elbows, knees, and ankles. The articular capsule surrounds the joint and consists of an outer fibrous layer that provides support and an inner synovial layer that absorbs and secretes synovial fluid. Articular cartilage is a type of hyaline cartilage that covers the ends of the bones within the joint and helps to minimize friction and absorb shock. Synovial fluid fills the joint cavity and has three important roles: lubrication, nutrient distribution, and shock absorption. Synovial joints, the most mobile type of joints in the body, allow for a wide range of movement, so they are the joints most susceptible to wear and tear or injury, leading to arthritis. Osteoarthritis occurs as the articular cartilage on the ends of bones within the joint begins to break down and lose its protective qualities. When this occurs, the ends of the two bones within the joint can rub together, deforming the bones and causing inflammation within the synovial joint. Dogs, more so than cats, can suffer from arthritis in their spine, and this occurs in a cartilaginous joint called an intervertebral disc. These discs are comprised of a thick outer ring of fibrous cartilage that surrounds a gelatinous core and allow for movement between adjacent vertebrae, absorb shock, and transfer loads through the vertebral column. Intervertebral discs can begin to lose their structural integrity slowly over time, causing them to become harder and thinner, so they lose their shock-absorbing qualities and no longer cushion the vertebrae properly. This weakening of the disc tissue will typically progress to bulge or rupture, which can compress the spinal cord. This can happen more quickly from any injury, even a simple act like jumping or a poor landing off of an elevated area. Prostaglandins are hormone-like chemicals in the body that contribute to inflammation. Nonsteroidal anti-inflammatory drugs, or NSAIDs for short, block a specific enzyme called cyclooxygenase, or COX, used by the body to make prostaglandins. By reducing production of prostaglandins, NSAIDs help reduce inflammation and associated pain. That's the good news. Sadly, NSAIDs also have common side effects. NSAIDs block both types of COX enzymes, COX-1 and COX-2. Unfortunately, the COX-1 enzyme is responsible for producing prostaglandins involved in the protection of gastrointestinal mucosa, and without these, serious gastric ulceration and bleeding can occur. Another issue with use of NSAIDs is an increase in AST or ALT liver enzymes on a blood test. These enzymes are released when liver cells die and indicate the liver is being damaged. In addition, the use of NSAIDs has been shown in scientific studies to accelerate articular cartilage breakdown in osteoarthritis, meaning damage to the joint will get worse when using this medication. Clients have also reported lethargy, loss of appetite, and diarrhea when using NSAIDs. For these reasons, we believe that NSAIDs should be used only for short periods of time for acute needs, and longer term only as a last resort after you have explored more natural alternatives, especially for younger dogs and cats. One of the biggest mistakes that pet guardians make is feeding a diet that does not support joint health. Commercial pet foods provide few nutrients that support cartilage or the ligaments and tendons that maintain joint integrity. In the wild, canines and felines consume a diet rich in nutrients like glucosamine, chondroitin, and collagen, along with sufficient protein that are naturally provided in a carnivore's diet. Regardless of what type of diet you feed, providing your dog or cat with joint supplementation is very important. Since veterinary medicine treats disease, most pets do not receive attention until they have signs of arthritis. By providing your dog or cat with joint supplementation from a young age, you can help make sure they avoid the discomfort of arthritis in the future. If your pet is older, it is never too late to start providing nutrients to support their joints. At the Pet Health and Nutrition Center, we provide the finest supplements to support your dog and cat's joints. Our supplements are the highest quality human-grade supplements for pets available and are packaged without any of the fillers, chemical additives, or preservatives found in many other pet supplements. Our Daily Multi Plus provides USDA organic whole food nutrients to support overall vitality, along with digestive enzymes and probiotics that increase absorption of protein and other nutrients from the diet. Elk Velvet Antler is sourced from pasture-raised Canadian elk, providing natural whole food nutrients that support joint health and have anti-inflammatory qualities. Bovine cartilage provides the type 2 collagen that feeds articular cartilage to help maintain its protective qualities. And our collagen from New Zealand, pasture-raised bovine, provides types 1 and 3 collagen that support the health of ligaments and tendons that give structural integrity to your pet's joints. Pet Health and Nutrition Center. Helpful by nature.